you're right on time for The Proof, where we provide nothing but the facts. Today, we're discussing a critical issue, that is Nigeria's reliance on imported vaccine. From the COVID-19 pandemic to outbreaks of Mpox, yellow fever, cholera, and diphtheria, the country's dependency on foreign-made vaccines continues to be a challenge. Is there a path to self-reliance? Let's find out on today's show. I'm your host, Darshan Usman. Thank you for joining us. This is The Proof, powered by Africa Check. Joining me now is Mukhtar Balogun, researcher at Africa Check. Good to see you, Mukhtar.
My pleasure, Darshan. Thanks for having me.
Let's start by talking about the history of vaccine production in Nigeria. It seems like Nigeria was once self-sufficient in making vaccines. What happened to that capacity?
Indeed, many people don't know that Nigeria was once a key player in vaccine production. Between 1940 and 1991, the Federal Vaccine Production Laboratory in Yaba, Lagos, manufactured vaccines for smallpox, yellow fever, and even rabies. In fact, by the late 1980s, Nigeria was producing over 500,000 doses of the yellow fever vaccine annually, some of which were even, shared to other African nations. However, by the early 1990s, the facility fell into disrepair. There were plans to, upgrade the laboratory, but those efforts were abandoned. Today, the site is unfortunately occupied by squatters, and Nigeria relies heavily, on imported vaccines.
That's a shocking shift from self-reliance to dependency. Now, why do you think those plans to restore the laboratory were abandoned?
Several reasons, including mismanagement of resources and lack of political will. There was also a shift in focus, towards importing vaccines, which, at the time seemed like, a quicker solution during times of disease outbreaks. But as we've seen, this dependency can and has often left the country vulnerable.
Let's talk about the current situation. We've seen recent outbreaks of Mpox, diphtheria, and cholera in Nigeria. What has the response been in terms of vaccine availability?
Yes, unfortunately, Nigeria is dealing with several health crises simultaneously. For Mpox, as of September 2024, there were 78 confirmed cases, with children under 5 being, particularly affected. Nigeria received, 10,000 doses of the Geniox Mpox vaccine from the US in August. But this is basically, enough for at-risk groups such as children, individuals with certain risk behaviors, basically the most vulnerable groups.
So only 10,000 doses for a population of over 223 million? How are vaccines being prioritized?
Exactly. It is not nearly enough for the general population, but the World Health Organization and Nigerian authorities have identified 5 states, Bayelsa, Edo, Cross River, and Lagos, as priority areas for vaccination, focusing on high-risk groups.
Mukhtar, let's take a quick break here. When we come back and pick up the conversation, we'll look at where things stand with cholera and the wider implications of Nigeria's vaccine dependency. Stay with us. Welcome back. This is The Proof, powered by Africa Check. It's a collaboration between News Central and the continent's leading fact-checking organization. This week, we're looking into the issue of vaccine dependency in Africa's most populous country, Nigeria. Now, the country has gone from producing and even exporting vaccines to being dependent on vaccines coming from outside. Mukhtar Balogun, Africa Check researcher, has taken us through the history of vaccine production in Nigeria and the status of things regarding the Mpox vaccine. Now, Mukhtar, let's look at other diseases like cholera and diphtheria.
For cholera, Nigeria has been using vaccines from companies in the UK, India, and Korea. In 2022, over 9 million doses of oral cholera vaccines were approved by the World Health Organization for Nigeria. But these are also reserved, for people at high risk. Diphtheria vaccines, on the other hand, are provided through Gavi's global partnership with 11.7 million doses delivered to Nigeria. But once again, millions of children still haven't received the required doses due to gaps in distribution and accessibility.
Mukhtar, what are the broader consequences of Nigeria's reliance on foreign-made vaccine?
Well, this is quite simple. So when you rely on external sources, you are at the mercy of those providers. As Prof Oyewale Tomori told us, you have to work with whatever they give you. You don't have control over the amount, the number of vaccines you are given. So this dependency undermines Nigeria's ability to adequately prepare for and respond to disease outbreaks.
That sounds like a very precarious position to be in. So what would it take for Nigeria to regain control of its vaccine production?
What we need is national commitment. Not just from the government, but from various stakeholders. Prof Tomori has been very vocal about this. Nigeria has the human, and natural resources to do a lot of things, including, building vaccine productions, and there is a chronic issue of mismanagement, which has been, general issue in our industries. So local production would not only, reduce foreign exchange costs, but also create jobs and strengthen our healthcare, system.
Thank you, Mukhtar Balogun. This has been a very insightful conversation.
Thanks for having me, Dashen.
It's clear that while Nigeria faces significant challenges in vaccine production, there's a path forward, one that requires commitment, investment, and careful prioritization. But until then, the country remains vulnerable to the global vaccine market. That's the reality we must confront. Thanks for joining us on The Proof. If you have comments or claims you want us to fact check, tweet at AfricaCheck_NG. Follow News Central on our social media platforms at News Central TV and visit our website at www.newscentral.africa. Stay informed and stay alert. I'm Darshan Usman, signing out.